been fantastic. The support has been excellent from the representatives, the area representatives, the sales representatives, the science, the clinical decision-making support as high up as Dr. Mulholland, all the way down to the reps themselves. I feel very supported, guided along our journey, patient selection, how to use the device, use cases, indications, and how to integrate it into our practice. It's been excellent, I can say. You agree?
I agree.
Well, I've been an InMode customer since 2013, so I've seen the transition that has occurred and how the technology has advanced over the years. I've been able to experience all the dramatic changes that have occurred and all as how the technology has continued to improve. And that's why I've been the steady customer since 2013 and continue to be. Well, InMode, unlike any other company that I've ever dealt with before, whether in the aesthetic industry, it's not a one-shot, one time, and that's it. They're always there helping you out. They're always there for support. We have 4 big launches every year in our clinic. They're always there for us, providing support, going over some of the technology, providing extra services. And it's just been a great experience, unlike how it's been with other laser-like technologies over the years.
My experience has been wonderful. So the long and short of it is I took over my practice in 2019. I purchased my first 2 devices with InMode within 6 months of owning the practice. And by bringing these devices into my practice, it allowed me to shift from a completely cosmetic surgery practice over to a fully non-surgical practice, which allows me to work 3 days a week and not take call. And the support from the InMode team has been awesome. They provide you with marketing support, educational support, training support, and wonderful events like this. And then I got into an additional device, so I now own 3 devices.
For me, it's been phenomenal. It truly has been the game changer for our practice. We started partnering with InMode shortly 2 months after opening our practice, and we launched with the Empower platform. And I can honestly say if it wasn't for the Empower platform, we may not still be here today.
I started becoming an InMode customer in August 3 of 2000. Since then, we've expanded the med spa into multiple locations. We have 4 different med spa devices, and they continually help us upgrade our devices to new technologies, which allows my med spa to grow along with the industry.
As an InMode customer, my experience has been absolutely amazing. I have one of the best reps, I think, in the company. She has been so accommodating. She's been so informative. It was one of the best purchases that we made for our practice.
There's several things happening in the economy. You have election, you have inflation, you have higher interest rate. So a lot of people are not doing the high ticket items. So because of that, we've really pivoted with the InMode technology, combining things like Morpheus. So if somebody comes in for neurotoxin and they have loose skin, we're introducing Morpheus to it. If I do a breast lift, I'm doing Morpheus to tighten the skin. Every liposuction patient, because you remove the fat, you have loose skin, so we can combine body tight, face tight, and Morpheus. So the InMode technology has really helped us stay afloat. InMode has really been like, they're a trend right now. One of my favorite InMode team members is Kit. He calls, I call, he answers my call every time. So he's been a very cooperative relationship. I love the reps, are very helpful when you need them.
So I actually purchased multiple machines from the very beginning. And so Morpheus8 has been huge for me in all my practices with all my practitioners.
InMode's been great for my practice. It's particularly face tight and also Morpheus, sometimes paired together.
What was the most surprising to me was that most of everything from the get-go was very well explained, and also the support that we got in education. What I noticed when I compared InMode to the other technology companies out in the field is that InMode puts a lot of money into the research and development. So in doing that, we're very capable of providing good care that's safe, efficient, and effective. And when it comes to a doctor, if you're able to predict results every time that you speak to a patient, your practice does a lot better, your reputation does a lot better, so does your brand. So to be able to be with a company like InMode that has the support, the research and development, and a brand that stands close to your own brand, it's easy.
It doesn't matter where you go, what you do, how you do it, someone's there to support you. These events are great. I can go talk to Dr. Mulholland, Dr. Meningus, just pull them off the stage in a break, and the support is amazing. Our reps have always been there. They follow up at least twice a month. We have clinical coordinators that can help us get things done. You're never left with an unanswered question.
I've had a profoundly amazing experience. I've been supported the entire way, and I'm lucky to have support staff and the team to help from everything from educational content to help with team training and staff training, and it's a great experience for our patients.
It's been a great experience working with InMode for the last 2 years. My reps, they take good care of me whenever we need a help or there's a problem or a question. They always answer the phone and they're there for us. For me, my nurse, my medical assistant, they answer questions, they're present when we need them. So the experience has been great.
I've treated thousands of patients with Morpheus8. And it's not just me. I have 8 other injectors / plastic surgeons, oculoplastics, OBGYNs in my practice. And it's become such a staple in my practice. It's the #1 procedure that we do in our office, in addition to injectables.
Well, we had the original Morpheus. We had the upgraded Optimus Max. I would say that we've treated a few hundred original Morpheus clients with exceptional results. We use photography to verify that. And with our new Optimus Max, we're able to have maybe about 5 or 6 clients since we were just trained on that August 1.
So I have treated approximately 2,000 patients at this point. So I've had it for about 5.5 years. I max out at about 5 a day. I don't let them put any more than 5 a day on my schedule, but we're at about 2,000 Morpheus treatments that I have done myself at this point.
We're a relatively new practice, so patient count may be 15 or 20, but each one of those patient counts, we do typically 3, sometimes 4 times. So we're upwards of 50, 60 treatments of Morpheus currently. And as marketing continues to expand, this week I know for a fact we have about 3 or 4 more bookings for Morpheus, so it does continue to grow.
I was going to say with each Morpheus patient too, not only are they doing Morpheus, they're also getting Lumecca, laser hair removal. Now they're all coming in for the women's health platform. So you just keep bringing in patients.
So I've treated a ton of patients with Morpheus. On top of the 3 clinics that I have, all 3 of them have Morpheus technology. Whether it be body Morpheus, whether it be face Morpheus, whether it be vaginal Morpheus. So all 3 of my clinics stay very busy doing Morpheus. And the nice thing about that is that I don't have to be there for all that. It's an extender prep, so I'm able to make money while I'm not around.
So we have 3 Morpheus machines, 3, right? So we have the med spa, we have the practice, and in surgery, our surgery center. So we use Morpheus in the med spa, in the practice, and in surgery. I combine it with everything. So safety, I mean, we use it on all skin type. The majority of my practice is skin of color. So we have used Morpheus to do all kinds of stuff. We have thousands of patients treated, so we know it's very safe.
We've treated hundreds of patients. I've worked with that platform for probably the past 5 or 6 years in previous practices and now my own. When I decided to open, I wanted a machine and only machines that gave results, were safe, and would provide my patients with everything that they wanted. So that was why we chose that.
Hard to count, but I would say when we first got started as an eye care practice, we were starting with about 1 every other 2 weeks or so, but now we're up to at least, I would say, 3 to 4 a week.
I have treated Morpheus8 V for vaginal rejuvenation, Morpheus8 face, Morpheus8 body, pretty much the entire Morpheus8 technology.
We've done several thousand Morpheus treatments over the course of about 4 years, and a little over 500 face type procedures. And so for something that's I can delegate Morpheus, I typically delegate to a nurse practitioner, and that keeps her busy. And face type, which is done by myself.
Oh, we've probably treated about 500 patients over the years.
So we've had our Morpheus less than a year, so not even very long, but we've treated between face and body patients, probably over 100 patients with our device, so it's been good.
Okay, how many patients have we done with Morpheus8? I think in average, I think I have more than 2,000 patients, more in body, but we do also in face. I think it's a device that for being as recent, it has been around like 2019 and all. It's a great device. I think it's the kind of devices that can be used by yourself, or you can actually delegate to someone else. It's very easy to use. The learning curve is very fast.
So when they ask about Morpheus8, they come in by name, which is really cool. So it's a lot of like celebrities are using Morpheus8, so they kind of know the name. And when we advertise it, they're really excited about it because they see the result that these celebrities have.
So when I first brought Morpheus8 into my practice, that was in 2019, and it was in the process of becoming a household brand. At this point, it is very much a household brand, and to the point where it's the standard of care, in my opinion, for facial aesthetic practices.
So Morpheus8 brand has helped significantly grow my business. I think it has been one of the best investments for our practice because it offers skin tightening to most of our patients that need that before we go in with our other modalities.
Morpheus8 brand has helped my practice because once you get that kind of B2C, right, business to consumer, people are actually coming to us and asking us if we offer Morpheus8. And I think it's great because, you have Kim Kardashian speaking about it on TikTok and social media. And I think it's such a great time in our lives because everyone is more educated now than ever. And being on social media and being visible and being able to educate the masses is something that I love to do. So without me even saying what Morpheus8 is, the brand itself really draws in a lot of people, and patients are coming in asking my front desk, do you guys do Morpheus8? Does Dr. Lana do Morpheus8? And the answer, of course, is yes. In all of our practices, we do Morpheus8.
It's elevated our practice tremendously. One of the big things that we wanted to do was bring kind of a multidisciplinary, multifaceted approach to our hormone and weight loss patients and our aesthetic patients. Instead of just Botox and filler, we want to be able to address skin laxity. We wanted to be able to address other elements of aging, collagen and elastin loss. And we could not do that until we had those products. We specifically sought out InMode for their reputation with Morpheus, but also the reputation as an excellent aesthetic and device company.
I agree. I'm one of the injectors at our practice, and so I kind of rely more on regenerative type medicine, and so that's probably, I recommend Morpheus8 before I even recommend fillers or Botox, so that's been a game changer for us.
Morpheus8 in particular has been a staple of my practice, and we use it in conjunction with social media primarily as either a standalone procedure or combined with other procedures.
I love Morpheus8. I think it's a great piece of equipment when used under the right hands. I have elevated my results. I think it has elevated the results with body contour and plastic surgery, which is my niche, taking the results to the next level when it comes to skin tightening.
Morpheus8 has, like I said before, really reformed our practice because it's just not just Morpheus, it's the skin treatment. We're combining with everything that we do because as you age, you're losing collagen, right? You can't drink your collagen, your body has to make the collagen. So it's really, what we're calling is collagen induction therapy. So we use it to induce collagen, so your skin is looking more vibrant. Your skin is from face to your thighs. We use it in everything, even for cellulite treatment with all that. So Morpheus pays with almost everything that we do in our practice. It's probably the best thing since sliced bread. If you see, it really, really is. I mean, bread makes you fat. Morpheus tightens the skin, I guess.
I think it sets us apart from just everybody else. Morpheus InMode has a brand. It has power to it. So when you offer Morpheus Optimus as opposed to Cartessa or Cool Peel or Cool Sculpting and some of these other platforms, it just stands above the rest. So when someone comes in and asks about weight loss, which is huge right now, and we say, hey, we're offering these treatments from InMode on these various platforms, it really just stands above the rest. So I think that's changed our practice tremendously because now people lose weight. They want to look better as well. They want to feel better, and we can offer these treatments.
Yep, they're tightening up their skin, body, thighs. They feel great.
Yeah, and I think the Morpheus as a brand has been recognized as the Ferrari of these devices. Nowadays when we see a lot of companies have done literally like replications of the device, but anyway, they cannot replicate how efficient it is. I don't know why, but they haven't been able to do it. And I think the the fame of the Morpheus is that it's the original product. I think that's the key.
Everyone knows of the Morpheus8. It's a household name. People come in asking for the treatment. And what's great for us is because we focus on both dry eyes and aesthetics, the eye area is such a delicate area that people really are concerned about when it comes to aging. And they know that Morpheus provides this great result with a big difference. So it's helped us tremendously.
The brand of Morpheus8 is just because InMode has invested so heavily in the technology that they're able to bring in this technology into a med spa space with other competitors. But InMode has the science behind those technologies. And so we're able to be very confident with providing those services to our clients. It's with documented studies, with documented technologies. And we have the ability to be assured that our patients are getting the best technology available on the marketplace. With the continued advances with the InMode technology, with the new Optimus Max, we are further assured that InMode's paying attention to those market trends and actually providing those best services.
So, other people talk about microneedling devices or other devices, but Morpheus in itself, everyone knows that brand, unlike other microneedling devices.
Brand recognition in the aesthetic industry is key. And I feel that oftentimes when clients want skin tightening, they specifically ask for the Morpheus8 technology. People do recognize the brand 1000%.
Most people know what it is, right? In the past, we used to have to spend a lot of money marketing, getting the name out. Well, now the name is so popular and it works so well that people are coming in from all over the place. I've taken a practice that I used to be all medical. I was delivering 40, 50 babies a month. I wasn't having any time with my family, but I thought that's just the way it was supposed to be. I was an OBGYN. Now I'm no longer delivering. If I'm up at 2 in the morning, it's because I want to be. So yeah, Morpheus has changed my whole entire life.
The results you're seeing are actually pretty quick. It takes a few months to see the results, about 3 months, we always say. So the third month after that last treatment, they're gonna get the best results.
I think Morpheus8 have helped my practice greatly. When I do my body contouring cases and I take the fat out, for example, when we do liposuction, we want to make sure that the results are elevated, that the skin really retracts and enhances the anatomy and the shape. And with the help of Morpheus, we get the tightening. In my practice, I've seen the results more dramatically around the neck, around supraumbilical, around the umbilicus, where you do the lipo and there's a little bit of laxity around the umbilicus. In that patient that is not ready for a full tummy tuck but needs lipo, Morpheus works great, getting tightness around the umbilicus, and I've seen great results also on the arms and around the knees.
From Morpheus8, we're getting really lovely full face and neck rejuvenation results. We're seeing improvement in pore size, skin tone and texture, tightening, overall contouring, and really just setting back the hands of time.
With the Morpheus8, I've been seeing really natural results with our treatments for the patients. Their main concern is usually like skin laxity, under eye heaviness or hollowness, and the treatments has been great because we found with just 1 or 2, it's been very, very effective.
Yeah, we've had great results. So we have patients that come in for me specifically. I work mostly face and neck area. So patients that need fat loss, especially in the lower jowling area, I'm able to pinpoint that with Morpheus8. But then people that also need or have issues with texture, things like that, Morpheus8 touches on that as well. So our results have been amazing.
And what I love about Morpheus8 too, it's a very good adjunctive procedure and device to our other InMode devices that we use, such as the Body Tight and Face Tight. It's been phenomenal. And we approach that in a dual treatment session where I'll do more of the Body Tight and Face Tight, although Morgan does participate and do that. And then she'll come in with the Morpheus8 to give us a rounded off, comprehensive finish and get the result we want at the skin level, not the subdermal or subcutaneous level only.
Well, the results with Morpheus are tremendous. In terms of having a radio frequency device as well as a microneedling device all in one, where everything is controlled, obviously based on the user who's using the device. But the technology is an amazing technology. And really, it's the best of its kind in terms of radio frequency combined with microneedling.
My patients have been very happy with the Morpheus8 results. Not only for skin tightening, but just overall collagen and elastin stimulation, just to regain that youthful appearance back into the face. Some of the results that we're seeing with the Morpheus8 technology are improvement, skin quality, texture, tone, clarity. You can have a snatched jawline all day long, but if the quality of the skin is not impeccable, the results really don't stand out to be too significant. So when you compare that with skin tightening and overall improvement of the skin quality, I think that is really the ultimate goal. And then we also are very proud owners of the Empower platform. And so we're seeing a significant improvement from a women's wellness perspective, from lichen sclerosis to recurrent BV, UTI, stress, urge, mixed urinary incontinence, overall the aesthetic appearance of the labia tissue. And so for women in our practice, that's key. So just restoring their confidence, whether it's from the inside out, has been a definite perk for our business.
Yeah, Morpheus8 has really been great in terms of primarily skin improvements. We like to do a combination of treatments with Morpheus8, typically not just one treatment, although that can be done, but it's usually a package of treatments, 3 or more treatments, and we see phenomenal results in terms of fine lines and wrinkles, pores, texture, pigmentation, and acne as well.
Over the last few years working with Morpheus8, the results that we've seen have been incredible. So we are able to customize this treatment to exactly what the patient is looking for. So we get skin tightening, we get skin tone and texture improvement, we're able to dissolve and remodel certain areas of fat. So our patients have been so happy.
So my Morpheus8 results, I mean, I can talk about it from all different areas that we're treating in the body. So I'll start with where I feel like I'm the most expertise at, the pelvic floor. That in America, the standard of care for patients in the pelvic floor is just 6 weeks after they deliver, do your Kegels and good luck. The outcome of that is that 70 to 80% of our female patients end up with some type of pelvic floor dysfunction. That pelvic floor dysfunction leads to depression, anxiety, obesity, heart disease, and all those things. So to be able to prevent pelvic floor dysfunction in our patients, which we basically are capable of with our internal vaginal Morpheus, by tightening things, by improving things, I'm able to change the patient's complete life. So over the last 5 years, my practice with just the vaginal Morpheus has changed tremendously. Because what I didn't used to have to offer a patient, all I had was a knife. Now I have the capability of preventing things. I have the capability of making things function better, and I have a capability of improving that patient's quality of life. And that's just the vagina. That's without speaking of the body Morpheus, that I'm capable of contouring and having that patient a whole lot more confident in their own skin, as well as improving scar tissue in the face, acne scarring, wrinkles, all those things. So if anyone has a practice that's a med spa that's about women's wellness and they don't have a Morpheus, they're missing a huge part of what's capable of helping those patients.
So we're just starting to see all the results coming in now. Most patients are a good 3 to 4 months out. Everybody says their skin looks great. They're getting a ton of compliments. People are asking what they're doing.
I think the dermal resurfacing part of it, the tightening of the skin. We have a patient that just finally wound up doing 4 treatments for skin laxity after losing a bunch of weight. She is just so thrilled. The treatments work and people love them and people notice them.
They're taking pictures again.
Yeah.
They're taking their pictures. They're out on the beach and they love it.
But it depends on the purpose of the Morpheus. You know, you can set it up for just doing skin retraction, or you can set it up to doing some lipolysis.
I think that's a big thing. When we were sort of trained, which we understand training, and that you're starting out, we started out just kind of everybody was at 2 millimeters, and that's a safe level to be at. But as I've gotten more advanced with the procedure, again, people come in and they have that heavy jowling or the heavy submental area. So I really focus on going to that 3 millimeters, 4 millimeters. And now with the newer Morpheus, we can go to 5 millimeters. That's how we address those fat areas. But we let the patient know, like, hey, we're not gonna mess with your cheek area. We'll make sure you still have those high cheekbones. We're not gonna break down any fat there, just so that you have a good contouring of your face. Same thing with body, which I know most people that come in with wanting Morpheus on their body, they really want that fat breakdown. So we make sure the patient knows that we go to a level where we really break down those fat cells for them, but also give them the skin tightening as well.
So what's really been the game changer is InMode support, and they're teaching us that clinical decision making through the different programs they have. So Morgan's gotten really good at the face, and she's even taught me some of the techniques for the body. But you can use the variability and the versatility of the Morpheus to address the issue of fat loss. Meaning, there are times when you do want fat loss. There is times when you don't, and it's based on the anatomy, your knowledge of that, and InMode's very good at teaching that, where to use it, where not to use it. It's not difficult to understand or apply. We've not seen excess fat loss be a problem, and we've been pleased with fat loss where we want it as one of the results.
If you want to use Morpheus8 as a tool to get rid of fat, you have to set the depth at the right level. So anything beyond 3 millimeters, you know that you're going to be targeting the subcutaneous fat. So that's why it's so important to go to a provider that's trained and knows how to use this piece of equipment, because once you hit 3 millimeters or deeper, you can target that fat. But I'll take that question further. If somebody's scared or concerned that they don't want to lose the fat and they have heard, I have found myself educating patients, telling them, if we use the technology right and we stay within the right depth, there's no way we're going to risk losing the fat that we want. It's all about education. It comes about education, letting the patient understand that we have different levels or layers in our skin. And when the skin ends or the dermis, that's where the fat starts. We call it the subcutaneous fat. Anything above 3 to 4 millimeters, it's already at the fat level. So if somebody's concerned that they heard or they read that Morpheus can kill the wanted fat, we can make them ease their minds, understand what we're going to do, and stay within 1 to 2 millimeters for skin tightening, avoiding the risk of losing the fat.
So fat loss in certain areas is a big topic. There are certain areas that we don't want fat to be lost, and there's certain areas that we do want fat to be lost, such as submental and of course body as well. And so when I talk to my patients, I really go over all the different layers of the face. We have our skin, our superficial fat layer. We have our SMAS, which is our muscle layer. We have our deep fat, right? And so as we age, we understand that aging happens in a very predictable manner. You get that gliding motion because our deep fat is lost quicker than our superficial fat. So for certain instances, we can go superficial, really target the extracellular matrix in order to build more collagen and elastin and not losing fat. However, in our abdomen, in our flanks, in our inner thighs, in the arms, which is the most stubborn area that, even I need it done, we're using Morpheus in those areas because not only can you target the fat, but you also target the skin for that nice skin retraction. So you gotta have both. A lot of the cold energy devices out there don't do that. And so really being, an expert in the field of body and face contouring, Morpheus has everything that you need to really get to the different layers that can give your patients the outcomes that they deserve.
Every time I see a patient, I say, what do you want to change about yourself? A lot of people say, oh, I hate this part. Okay, well, we'll assess what do you hate about it, how do you want to look, and then we do custom contouring with the Morpheus8. So we'll target all those the adipose tissue to kind of give them like a snatched jawline. The way that I assess it is more so like how much fat do we have there and how much we can boost up the Morpheus to give that patient those results.
Morpheus8 is a very effective treatment when used with the proper settings. So it all depends on personalization for your treatment plan for the patient. So under the eye, we try to go lighter in settings and to not worry, because even though the Morpheus device has the ability to help with fat burning in certain areas, when it comes to the eye area, we're very careful with our settings so that we ensure that we don't cause any hollowness around the eyes.
With any device, the user, whether a doctor, an NP, or whatever that's using the device, they have to understand what that device does. So if it's done in the right hands and you understand the anatomy, and that's why when I talk to other physicians about Morpheus in particular, that person has to understand the anatomy. And in terms of fat loss, obviously, there are areas where we want fat loss, but there are other areas we do not want fat loss, depending again on that anatomy. So if you understand what this device does and the capabilities of this device and the anatomy, it's a very simple tool because all of the technology, the InMode company has provided that technology for you. And if it's used in the right hands, it can be utilized and you can get great results.
So it truly is up to the provider to know what they're doing and why, and to properly assess and select the proper patient selection, the proper settings. So it all comes down to ultimately what the client's goal is, the settings that you use, and to collaboratively decide like what the patient wants. Do they want to keep their fat and just, have the skin tightening benefit, or do they really want to contour and reduce that submental fullness? So at the end of the day, it depends on what the patient wants, what their goals are.
When we're assessing for fat loss in certain areas, when we do our full consult, we're obviously being in tune to the settings that we're going to need to use in case we do want fat dissolving, such as our submental area or buccal fat. But staying on DRG with those guidelines and really following that just helps us give our patients exactly what they want.
I love the safety profile of Morpheus8. It used to be that I only had lasers to rejuvenate the skin, improve fine lines and wrinkles in skin tone and texture. But now with Morpheus8, I can address all skin types, Fitzpatrick 1 through 6, which is lightest of the lightest skin to the darkest of the darkest skin, and it's very safe. In addition to that, I can treat the deeper layers of the skin very safely without any peeling because that energy is being deployed below the skin.
First of all, Morpheus is an unbelievable, powerful technology. The reason that it works is because it's so powerful. On the same note, it's very safe. But as any provider, anyone that's working on humans, you have to know your limitations. You have to understand your technology. You have to be intuitive in how you apply it. So we know in our field that everybody is putting a ton of fillers and things to keep their fat masses around the mid-face. So it would behoove us that if we're going to treat with a Morpheus, we don't go so deep that we're going to take away from that fat mass that everyone wants there. So it's a matter of understanding your technology. It's a matter of understanding your patient that you have and the different variables that you have to improve it. But if you understand that, your results and the safety of it is the best in the market. You know, normally when my patients are asking me about safety, I definitely like to go over the risk, benefits, and alternatives to all that they have. That's part of what we do as physicians. Then we also spend plenty of time explaining to them what we recommend, what we feel is going to be the best outcomes with the least risk. And that's almost always Morpheus when we're talking about skin tightening, improving in all the aspects of the skin. So I tell them, that number one, on top of it having good outcomes, that the technology behind the Morpheus is very safe, and the likelihood of having anything that's permanent or anything that's going to cause them any issues in the long run is slim to none.
Every procedure has safety concerns, of course. So the most important thing with Morpheus, I think, is assessing the skin type. So we use the Fitzpatrick scale as well as the ethnicity of the patient, because of course we want to avoid things like hyperpigmentation and etc. So I always advise them, depending on your skin type, these are the settings that we can use, and these are the settings for the goals that you want to achieve. And then we make a decision from there.
Morpheus has been out for at least 5 to 8 years, right? And so the safety data is out there. And not only that, but radiofrequency microneedling in and of itself is very, very safe. I understand that Morpheus8 is different from other companies as a bipolar radiofrequency where you're going to get the electrodes from the end plate to the tip of the needles. And so when you build that in for lots of practitioners, not only for surgeons and physicians, but for other staff members who are doing it, it's a very safe technology. And I think it's great that the company really, really focused on the safety and efficacy of Morpheus8.
Well, like with any other device, whether a laser, whether radio frequency, whether a microneedling devices, it's based on one, technology. Two, it's based on that person that's providing the care and utilizing that device with that individual. And I think if you understand that and you explain to people and you understand the person that you're dealing with, whether their skin type is skin type 1 versus skin type 6, that device can be utilized safely under those circumstances.
Well, there's always a concern about safety with all of our clients. We want to make sure that they're fully educated. But with the technology of Morpheus, as long as they pay attention to some very key principles, to be cautious of going out in the sun afterwards, screening our patients properly with medical histories. Our nurses are very specific with selecting patients that will get optimized results. We're looking at different skin tones. We're looking at different parameters to make sure that it's the proper patient for the technology. So once we have met those criteria with our patients, we are able to give them assurances that they are able to get the technology delivered properly with very little risk or downtime.
Regarding the safety of Morpheus, it's a safe device. It's a powerful device. There has never been any concerns, really, at least from my patient standpoint, is it safe or not, because I convey that to them. I'm very comfortable with performing the treatments. I understand the technology. I know what I'm doing and why, and I think that's key when it comes to determine the safety of the product.
When our patients come in with concerns about Morpheus8, whether it's safety, whether it's pain, we do tons of education. This machine, if it's in the right hands, is 100% safe. If the settings are followed correctly, then it is not as painful as the internet makes it seem. So overall, it's tons of patient education. Again, it's tons of patient education. I just tell them that we've been using this device for so many years. All my practitioners are well-versed. We're going to be able to give you the exact results that you want. And we go through that in the entire consult just to make sure that, that they're comfortable moving forward with it.
I tell them, just try it. You will love the results. So I always encourage people to go to my Google reviews because that is the #1 procedure that gets us a 5-star review on our Google ratings. In addition to that, I personally will never live without Morpheus myself on my own face. And then our before and after photos, we have people ranging from their 20s all the way up to their 80s that get beautiful, natural appearing results. So before and afters and reviews don't lie.
When I mention Morpheus8 to my patients, it's oftentimes when clients come in and they want dermal fillers. And I explain to them that we really need to kind of prep the house first before we build the walls. And oftentimes when we do dermal fillers, we have to wait until we see the tissue rise. And oftentimes the clients end up becoming overfilled, and that's what we want to get away from, at least in today's industry with aesthetic medicine. And so if we can skin tighten first, then you often need less dermal filler. And when I convey that to them, they understand the importance of really prepping the strong foundation of the house, getting that collagen, that elastin rebuilt and firm, and then we can find contour with like dermal fillers or neurotoxin.
I explain it in a way that is microneedling, where you're causing trauma to the skin so that the skin can heal and produce collagen. So if you think about yourself when you get a laceration or a little wound somewhere, your skin tries to repair itself. So same thing with Morpheus. We're utilizing different technologies to help boost that collagen and elastin peak in the skin. So it's trauma causing, but it's worth it.
Well, I think with Morpheus, the technology's there, it's well known. People are aware of it. And again, if the right person uses that device with that individual, understands what they're trying to accomplish and what you can accomplish with that device, I think you can allay everyone's fears with regards to that. You know, a lot of the biggest concerns initially was about pain, and there's always been this misconception, but there are so many other things that you can utilize to decrease pain and to, again, get great results with Morpheus. And if you explain this and spend the time with people, you can allay those fears, and yet they can still see the great changes and benefits that you can get with skin aging and the improvement of such.
Overall, it's a procedure that has very good results, can be repeated over time, can be delegated, so it's a procedure we love.
We do have a lot of experience with Morpheus8 in my office, so I like to think that we're very comfortable with Morpheus8. We see great results with it. We can do it very comfortably. There's really little to no downtime, perhaps a day of some redness typically. So in terms of someone that's just uneasy about it, I think I can reassure them that it's really minimal downtime, and the discomfort is very manageable.
Well, most of the times when you hear patients or anyone that's hesitant about it, it's because they hear about pain with Morpheus. Anytime that you're driving 24-pin needles or 40-pin needles to different levels, and it's also driving some radio frequency, some heat at the tips, you know it's going to be painful unless you do your due diligence at numbing them. So most of the pushback I get from patients is like, oh wow, that's going to hurt. But the truth is that if you prepare your patient properly and you do the right things to numb them, they don't have to hurt. And it's crazy because even the patients that end up feeling some type of pain, although you don't want that to happen, when they get the results, they're still wanting to do more, which is tells you how well it's working. But the goal is to make that patient as comfortable as possible, giving them the best expectations, and then doing your job properly. So most of the resistance comes with them hearing, oh, that hurt. But so we as providers have to do a way better job of numbing them and set expectations properly.
I think both of us, we've been providers for more than 15 years. I've worked I'm family practice. My husband's done anesthesia. He works with plastic surgeons. So we get to work on a different level as well, too. We really do sit back, talk to people, take their concerns, really think about it and address it. And honestly, we just go slow. If they're nervous, we just go slow.
Do your own research. You know, don't just go to Google or Facebook and, you know, because what's unfortunate is a lot of people talk about the bad more than they talk about the good on social media, and that's not the area you go. I think we ask them to talk to some of our patients, talk to people who have had the procedure and have had good results, because they do exist. And that's, again, you don't see the good online, you see only the bad. But in the end, think about it. Take your time. There's no pressure. There's no rush. Go home. If you have more questions, please come back. We'll do another consultation. Give us a call, email. People text us all the time, patients of ours. We don't mind that, and go over these things over and over again. And if in the end this is not the right treatment for you, then so be it. No big deal. You know, it has to be right for you. You have to be at ease with what you're doing. Just like a surgical procedure, you need to know the ins and outs, ups and downs of it before you actually do that procedure. And we're like an open book. Come in, talk to us. We have nothing to hide. We'll go over everything, and we'll go over it again and again until you are comfortable.
Yeah, I would say almost exactly the same. As if somebody comes in and they're hesitant about the procedure, it's what are you hesitant about? What are you hearing? And then when you kind of listen to what they're hearing about, then you can slowly kind of inform them and stuff like that as well. I don't push people into making a decision right away. So if they're hesitant, let me show you before and afters. Let me give you some research. Take your time. Come back and talk to me. And most of the time when people come back and they've talked to me, or they've now talked to other people, then they're scheduling an appointment.
So Morpheus8 is something that works really, really well. Specifically for specific patients, I know when I see someone's face what I can do with the Morpheus. All I need to do is explain to them and educate them on what it does, the technology, their safety, all their studies, but most importantly, show them the befores and afters. I get things done, my staff members get them done, my front desk gets them done. Not only do they get them done, but in between patients, they're like, Dr. Lana, can you please Morpheus my face and my neck? So it's something that once they see that we really believe in it, they see our befores and afters, they see befores and afters of all our patients. It's really an easy way to educate them to say, this is something to use in our armamentarium to get you to your goals of rejuvenation, anti-aging, really bringing back the clock. We don't only want you to look younger, feel younger, but we actually want you to be younger. And by building collagen and building elastin, it's actually making us younger. Who doesn't want that?
It is common, and it's a very realistic thing that can occur. So when I sit in the room, I spend a lot of time educating the patients, and I go through the entire consultation. I tell them that this is what my mom uses, this is what I use on myself, this is what my employees use. I show them the results, and I explain to them that there are things to look out for. Sensitivity, it depends on the person. So I would give them examples of what it may feel like, and we start slow. Every time we do a treatment, we start slow, let them see how they like it, and if they are able to tolerate, we continue. So it all depends.
So the first three things that come to mind when I think of Morpheus8 is efficacious. So this device works, safe, and beautiful natural results.
Safety, efficacy, and results. That's it.
Stability, empowerment, and growth. And in so many ways, not just from a business perspective, but from a client, restoration of confidence and youthfulness.
It's an easy procedure with really minimal downtime, some really significant improvements of skin. It's a comfortable procedure, the way that we manage patients in terms of local anesthesia, topical anesthesia, and it's a quick procedure in the office, and they can return home and really look good the next day.
Snatched, minimally invasive, and very low downtime.
The technology that InMode provides, and that it continues on and on and on, as you can see today. The first thing I think is technology. 2, I think of support. And then 3, the InMode brand and Morpheus in particular, great results.
With the results that you build with these patients are exceptional, spectacular results. And when you go out to the dinner and you see them laughing and giggling with their friends and family, you know that you've provided something that has been highly effective and that they're very happy with.
Safety, consistent results, and efficacy. It's one of the best machines that we've invested in.
That glow, texture improvement, that tightening, that snatchness of jawline, and then number 3, how happy patients will be.
When I think of Morpheus8, I think of rejuvenating, I think of transformative, and I think of it as a power horse in my work tool station.
It's huge. The results speak for themselves. When people go Morpheus, what is Morpheus? What are the benefits of Morpheus? you can go anywhere and someone will tell you how awesome the results are. So the skin tightening, the laxity tightening, the fine lines and wrinkles speaks for itself. And when you think about Morpheus8, its brand recognition, the support behind it, especially with a provider, that I think are the three top things. Morpheus is part of a big family. We're part of a big organization, a growing, and they're always on the cutting edge. So from our standpoint of what Morpheus represents, it's the safety, it's the results, and the brand recognition of a powerhouse company that really can help you take your practice to the next level.
Safety, no downtime, skin laxity, building of collagen. That's what I think of when I think of Morpheus8. I just want that youthful appearance.